How common is erectile dysfunction and what is it? Any man can have difficulty getting or keeping an erection on a given day. Erectile dysfunction is when this becomes a consistent problem. You can't get an erection most days or every day, or you can't get an erection that's adequate for intercourse. About 30 million men in the US have this condition, so it's fairly common. Here are some very common causes that are usually never discussed. Number one, pornography. This can make all types of erectile dysfunction worse. Pornography can be addicting, that's been shown repeatedly, and it can make it impossible to get an erection. Another common cause that's never discussed is there are certain food additives that block testosterone or increase estrogen. Just because something is organic doesn't mean it has no additives. There are a lot of organic additives that can hurt you. Most of our diets should consist of fresh, pure foods to avoid all of those additives that can hurt you, not just in terms of erectile dysfunction, but in terms of other things. Another cause, being overweight increases estrogen, decreases testosterone, and the weight itself puts excess pressure on your pelvic floor muscles. This can affect both your circulation, particularly the venous part because veins are easy to compress, but also the nerves as the weight bears down on those nerves. Another common cause is alcohol. Alcohol not only sedates you, but can make the erectile dysfunction worse by preventing the adequate response of the nervous system to get the erection. Another common cause that's never discussed, being sedentary. Weak muscles, especially, but not only the pelvic floor muscles, poor endurance, all of those things are related to erectile dysfunction. In fact, the poor cardiovascular endurance can be a sign of developing cardiovascular disease. Another cause is anxiety or depression. Anxiety or depression alone can cause erectile dysfunction, and the medications used to treat these conditions typically make erectile dysfunction worse. In fact, premature ejaculation is treated with antidepressants, precisely because antidepressants can make erectile dysfunction worse. Now, there are some conditions also that affect your vascular system, such as hypertension, or your nervous system, such as nerve trauma following a prostate surgery, and also your endocrine system, such as diabetes and low testosterone, that can all cause erectile dysfunction. We even now recognize that there are some syndromes that affect the endocrine and nervous system together and cause erectile dysfunction by altering many hormones, not just testosterone or insulin. It will be difficult to control erectile dysfunction without controlling these syndromes. So it's very important to identify the cause of erectile dysfunction in order to get it well controlled. What are some treatment options for erectile dysfunction? First, you need a good urological workup. This will help determine the cause of the erectile dysfunction and offer treatment options. There are many effective treatment options available, including medications, devices like vacuum erection devices, and surgery. There's a lot there. The best way to start is with your urologist.